At Fortune Smile Services Limited, we support all our service users in a person centered way. We put them in the center of their care, ensuring that they are in control of their own life. Fortune Smiles provides a supported living accommodation as well as domiciliary care service to adults and young people with learning disability, autism, mental health, physical or sensory disabilities who need lower, medium, and severe levels of support. We support clients in our services by following the guidelines of the CARE Act and the Health and Social Care Act, which focus on outcomes, personalization, and well being. We ensure that they are involved at every level of their care planning process and encourage them to use their funded hours allocated to them as they wish according to their needs. We offer different levels of support to different levels of needs required by the service user. We carry out a detailed pre-assessment with the service user prior to commencing care provision so as to gather as much information as possible about the potential service user and begin to understand who they are, what their needs are, who is important to them, what are their talents and gifts, their dreams and wishes, and who in our team would be best placed to support them. The assessment includes asking them about their likes and dislikes, the nature of any physical or mental health diagnosis, health history, religious and cultural backgrounds, and what their interests are, what level of support they require. We will present information in an appropriate format that they understand, such as written or verbal, easy read, social stories, marketing, pictorial, or communicate via apps or software for clients who are non-verbal. As part of our care planning process, we would carry out a mental capacity assessment if required in order to ascertain if they have capacity to participate in the decision-making process toward their personalized care. A best interest meeting will be carried out if a mental capacity assessment ascertains that they do not have capacity to participate. This would ensure that all decisions are made in their own best interest. Where the clients have capacity, they would be fully involved in the assessment process. They would invite those they want to be involved in the process, and they would also be asked to give consent for care and treatment. On receiving a referral, we'll conduct our own care consultation within 48 hours using the risk and needs assessment outlined in the care plan supplied by commissioners. We'll use the information provided as a baseline to develop a person-centered care plan with the service user wherever they feel most comfortable, usually within the home, with family members, significant others, and other professionals involved in their care, with consent, of course. We value the input of family/significant others in the care planning process. They are often experts by experience, having cared for the service user and understanding their likes and dislikes. We invite them to 6-month formally PCP reviews and to provide feedback on their satisfaction with our services through our quarterly satisfaction surveys or directly to the service manager. Family involvement can only be with the prior consent of the service user. If they do not want family input into the care planning process, we'll make it clear that we'll contact family members only on request or if there's a significant change to the service user's health. We invite multidisciplinary colleagues to care planning process and reviews to ensure that care package meets physical or mental health needs at home and in the community rather than requiring hospital admission. We understand that better outcomes are often achieved when there is an established relationship and rapport between the carer and the service user. So when delivering support, we'll usually assign a specifically matched lead worker to deliver the majority of visits, with 1 or 2 others attending when they're not on shift, on leave, or absent. When there is a change to the service user's needs, wherever possible, we'll provide specific training to their current staff team to ensure they are qualified and competent to continue to support them. Lastly, Fortune Smile Services Limited has a robust and comprehensive systems and procedures in place to keep our service users safe. We work to the principle that safeguarding is everyone's responsibility and ensure all staff across the organization understand their responsibilities around safeguarding. Our comprehensive safeguarding policy is refreshed annually with compliance to ensure it reflects all up-to-date legislation and guidance and covers all areas of safeguarding relating to the support we provide. Safeguarding is embedded in practice through regular person-centered support reviews, comprehensive training, one-to-one supervision, and access to guidance and support from our dedicated safeguarding lead, taking a lessons learned approach towards incidents. We acknowledge the right of our service users to take positive risks. We use risk assessment templates and processes to identify risks and mitigations, for example, removing trips or fall hazards in consultation with the service user, their support network, and multidisciplinary team, such as occupational therapists.